In this podcast episode, Dr. Majid Fotuhi shares his decades of experience in neurology and brain health, discussing the various stages of cognitive decline, the importance of differentiating normal memory changes from Alzheimer's disease, and the revolutionary advances in reversing early brain aging. He outlines his comprehensive 12-week program centered around 5 key pillars that can help prevent, halt, and even reverse cognitive impairment, emphasizing practical lifestyle changes, mindset, and targeted interventions to enhance brain function and quality of life. Dr. Fotuhi describes 3 main stages of cognitive aging. The first stage, age-associated memory impairment, is common and characterized by everyday forgetfulness, such as misplacing keys or not recalling sending an email. These lapses are often caused by factors like lack of sleep, stress, or minor health issues, and are usually reversible with simple lifestyle adjustments. The next stage, mild cognitive impairment, MCI, represents more serious memory problems where individuals repeatedly ask the same questions and show clear signs of hippocampal shrinkage, the brain area responsible for learning and memory. The final stage is Alzheimer's disease, a form of dementia marked by significant brain atrophy, behavioral changes, confusion, and loss of independence. Alzheimer's itself can be mild, moderate, or severe. Importantly, Dr. Fotuhi stresses that not every memory issue is Alzheimer's. Depression, hearing loss, vitamin deficiencies, and other health conditions often mimic early cognitive concerns. Dr. Fotuhi highlights how many people mistake common memory lapses for Alzheimer's, when in fact they stem from easily fixable causes. Hearing loss is underscored as a surprisingly prevalent cause of memory problems, citing a personal story where appropriate hearing aid use reversed presumed cognitive decline. Other contributors include poor sleep, air pollution, vitamin deficiencies such as B12 and vitamin D, and chronic medical conditions like kidney or liver disease. These are conceptualized as maintenance issues, similar to car upkeep, and addressing them can restore brain function without alarming diagnoses. Long-term untreated hearing or vision loss can lead to social withdrawal, reduced brain stimulation, and loneliness, factors that compound hippocampal shrinkage. Dr. Fotuhi explains how an unstimulated brain literally loses volume in critical regions for memory. He links this to studies showing that lifestyle-related factors beyond plaques and tangles, such as inflammation and poor blood flow, contribute significantly to brain aging and dementia risk. Contrary to past beliefs that Alzheimer's is irreversible, Dr. Fotuhi discusses groundbreaking research demonstrating that early-stage Alzheimer's and mild cognitive impairment can be reversed through intensive lifestyle modifications. These include brain training, exercise, diet, social engagement, and stress management. He references a California randomized controlled trial led by Dr. Dean Ornish that showed reductions in amyloid plaques and tangles and significant cognitive improvements after a 12-week multimodal intervention. New drugs targeting amyloid exist, but currently show only modest benefits, primarily slowing decline rather than improving function. Lifestyle approaches, on the other hand, have the potential to improve memory and even grow brain networks. Dr. Fotuhi's 12-week program is built on 5 pillars: fitness, optimal sleep, brain-healthy nutrition, mindset, and brain training. Exercise ranks as the most critical factor, recommended at a level where individuals can comfortably climb 10 flights of stairs or walk several miles. Increased physical activity correlates with lower rates of dementia in multiple populations, including communities in Northern Europe. He advocates small, sustainable improvements rather than drastic overnight changes to avoid undue stress. Sleep is second in importance, given its essential role in brain repair and clearing toxic proteins. Poor sleep patterns, especially in chronic insomnia or untreated sleep apnea, dramatically shrink the hippocampus and increase dementia risk. Dr. Fotuhi encourages treating sleep disorders promptly and emphasizes sleep hygiene, such as keeping the bedroom dark, quiet, and reserved solely for sleep, reading, and intimacy. Nutrition follows as a pillar with clear do's and don'ts. Dr. Fotuhi advises avoiding ultra-processed foods, sugary sodas, and trans fats, which all increase brain inflammation. Instead, a diet rich in leafy greens, a variety of fruits, notably blueberries for their BDNF-enhancing antioxidants, and omega-3 fatty acids, especially from fish like salmon and sardines, is recommended. He notes that omega-3 supplementation is often necessary to reach effective doses linked to reduced Alzheimer's risk, while maintaining enjoyment in eating is important for sustainability. Mindset is the fourth pillar, centered on stress management, adopting a growth mindset, and having a purposeful life. Chronic stress elevates cortisol, which poisons the hippocampus and shrinks it, accelerating cognitive decline. Dr. Fotuhi stresses personal responsibility in managing responses to stress, avoiding fixating on others or external causes. A growth mindset, believing in the brain's neuroplasticity, is critical to avoid self-fulfilling prophecies of memory failure. Having a clear purpose in life has been scientifically shown to reduce dementia risk by 19%, reduce stroke risk, and promote better brain synapse density, contributing to cognitive resilience even in the presence of Alzheimer's pathology. Brain training, the fifth pillar, involves daily stimulation of cognitive networks through activities like language learning, puzzles, dancing, or learning new skills. Neural circuits actively engaged undergo growth measurable on MRI. While brain training alone is insufficient to counteract major brain insults, combined with other pillars, it contributes to improved cognitive performance. Fun and integrated activities, such as hiking with social interaction or dance classes, can combine multiple pillars simultaneously, enhancing adherence and benefits. Regarding amyloid and tau biomarker testing, Dr. Fotuhi advises caution. While these proteins contribute to Alzheimer's pathology, having elevated levels alone does not guarantee dementia, and many cognitively healthy elderly can have plaques and tangles without symptoms. Furthermore, routine testing without expert interpretation can cause unnecessary anxiety. Currently, no standardized guidelines exist for managing these biomarker levels, as there are for cardiac risk factors. Testing may be more appropriate for symptomatic individuals who require a definitive diagnosis, but is not generally recommended for healthy people, especially without medical guidance. Dr. Fotuhi's program combines medical management of conditions such as sleep apnea and vitamin deficiencies with targeted brain training and support of the 5 pillars. Patients typically show noticeable improvements within 12 weeks, including memory gains that defy earlier assumptions about irreversibility. He shares inspiring anecdotes, such as a patient who memorized 100 words forward and backward despite initial disbelief. The approach includes comprehensive assessments across multiple brain function domains, fitness evaluations, and counseling to identify individual risk factors and targets for intervention. The program is supported by an app, also named Invincible Brain, that helps users track progress and receive customized guidance. Though in-clinic programs are still being established, the detailed protocols are publicly available through Dr. Fotuhi's book, Empowering Individuals to Begin Self-Directed Improvement Today. Dr. Fotuhi closes on the reminder that brain health is inseparable from overall happiness and quality of life. Investing in brain health not only reduces the risk of cognitive decline, but enhances daily well-being, resilience to stress, and satisfaction. He encourages listeners to think of their brains as gardens that require regular maintenance but respond beautifully to care. Small, consistent actions integrate to create long-term benefits. His philosophy combines rigorous science with an optimistic call for empowerment. Everyone has the capacity to improve their brain health and enjoy richer, sharper, and more meaningful lives at any age.